Time now for a segment brought to you by Aware Recovery Care. During the holidays, we of course want to gather with the family and friends and see that any of our loved ones struggling with addiction are of course safe and healthy. Well, there is a new innovative way to treat drug and alcohol addiction, and here now this morning to tell us more about it is Dr. Shelley Halligan, Vice President of Integrative Health Services. Good morning, Doctor.
Good morning.
A great pleasure to chat with you once again. You know, this is such a tough time of year for so many people, so many individuals out there really struggling, so it is good to know that you guys can really provide them with the care that they might need. But before we get into these innovative methods and whatnot, let's talk a little bit about Aware Recovery Care and really why this is so unique.
Thank you so much. It's a pleasure to be here. Aware Recovery Care is a 52-week in-home addiction treatment program, so we actually bring services and treatment into the person's home, and we treat the patient and the family in the safety of their own home with their loved ones around them.
And that is so crucial to this because you want to have that support system. And this is, to say it's a rocky road is the understatement of the year, because this is very difficult for people trying to navigate. So not only is it hard to begin with, on top of that, there are all these other potential pitfalls. So having it done right in the home and having the support of the family probably adds this layer of comfort to the experience on some level, doesn't it?
It takes away a lot of the trauma, too, of going inpatient, leaving your family, leaving your pets, leaving your friends, all of those different things. And also people can stay employed. You know, a lot of trauma having to tell their employer, I need to go to detox or I need to go inpatient, is very, very traumatic for the individual.
Right, and especially when we hear the words in-home withdrawal management. I was reading about this earlier, the fact that it can be done that way, that it is so innovative. Let's talk really how it actually works and who can benefit from it directly.
That is one of our incredible services. In-home withdrawal management is basically detox in the home for individuals, detoxing from opiates, alcohol, or benzodiazepines. We can detox them right in the safety of their own home. We have a criteria that they need to meet. They need to have a support person in the home, but the nurse goes in the home, delivers the medication in the safety of their own home, and the family is included in the detox so they understand the process of exactly what the patient is going through.
Right, and hopefully, like you said, with regard to work, they can maintain some sense of normalcy and keep a part of their routine in place.
Absolutely, and also keep some of their, that to themselves and not have to go out and tell everyone about their addiction, because there is still a lot of stigma and bias around substance use disorder.
That is so very important, and you invoked opioids there. Let's talk really about the innovative non-drug therapy used to treat this particular addiction, because we are hearing more and more about this particular affliction, if you will.
Absolutely, and we've seen the numbers from the CDC, and our overdose rates are really through the roof, and this is tragic for this population. And something that we have worked with is something called the ST Genesis, and it's from Speranza. And it's a device that goes actually on the back of the ear, and it is a percutaneous nerve field stimulator, and it stimulates the cranial nerves, and it gives the individual a non-pharmacological way to get through the detox of opiates, which can be so significant.
We're seeing some remarkable video right now. Does this only work for opioids? Or
right now, it is only FDA cleared for opiate withdrawal, absolutely. So it's only for that withdrawal, that substance right now, but it helps with the nausea, the pain, the anxiety. That vagus nerve, which means wandering, it really relaxes the individual, and the data that we're seeing is unbelievable with this device.
Well, you and your team have just, like I said, I was researching this a little bit, have truly done a remarkable job, and I know that the name of the game is helping these individuals, and you're certainly doing that day in and day out. So thanks for sharing the information with us.
Thank you so much. Really a pleasure to be here.
It's a pleasure to welcome you here. This segment brought to you by Aware Recovery Care. If you would like to learn more all about their services and their innovative treatment programs, we have information posted right now at roadshow.com.
Well, before you deck the halls, you may want to reassess, right? Take a look at your home. Make sure you've got everything planned and in order. John DeCosmo joins us now to give us some advice for Christmas light prep. Hey, John.
Good morning.